Hello viewers, I'm Simon and I'm a health practitioner, and we have come here to bring one issue that has brought us here. This is where the national government have been, the devolution has been brought, where the powers have been brought from the national to the grassroots, that's the counties. But also we are faced with a lot of challenges where the health sector have been neglected by the people in power in the county, that's our governors. But also, we have been, it has brought a lot of benefits. That's the development. There is a development in the county, building of schools, dispensary, but they have been mentioned mostly in the curative than the preventive. And this has left us with a lot of challenges. I discuss let one of.
Hello, I'm Emmanuel, and I'm going to discuss one of the challenges which is being faced as a result of devolution in our counties. We find that, okay, we have the curative and the preventive care, and the counties are giving an upper hand in the curative care, where you find that there is no equal allocation of the resources of the finances to cater for the health in the preventive sector, and you find that people are getting sick, so they go for the curative, of which it would have been prevented earlier before it occurs, and this is bringing in a lot of challenges. Okay, let's continue.
Hello, I'm Dr. Gugwa, practicing public health officer. As my colleague had said about the challenges, it is mandatory that the challenges should be cut down, since public health is the backbone of all the curative practices. Among the many challenges or the burdens of minute preventive medicine, these aspects of NCDs, rather like non-communicable diseases, mental health disorders, cardio, let's say the cardio-arrested diseases, and others like the heart diseases, have become a major burden in the current society. So, as a way of preventing these burdens, both the national and the county government should chip in and help or give a hand to the preventive parts of medicine. My colleague is going to discuss about some parts of the NCDs and the mental health disorders. Thank you.
Hi, I am Bertram Benson, public health officer, and I would like to echo what my colleagues have said pertaining to the topic on board. That's about our health as Kenyans and also as individuals who have interest in the aspect of health of the population at large. They've talked about the burden of health problems, the living of the individual, and even the living of the population and the community at large. And one of the factors raised by my fellow is about the mental health. And in a nutshell, mental health is the state of an individual where an individual is not stable. It's not stable in his mind, and it has been on the rise. And research shows that in about 5 individuals, one has a mental health problem, and mental health problem is linked to many factors. And one of them, we have our physical being, we have our well-being, or even the way we interact with others, having a hand in our mental state. And in a way, that's the way the mental issues are arising. As public health officers, we need to even rise in the way we create awareness about the same in the community. And this is done when the county government and the national government work in synergy. And in synergy, I mean they try to work hand in hand with each other to ensure that the community gets the information about this thing, whereby if an individual realizes that he has some mental problem, he or she quickly or promptly runs to the persons in charge, the personnel who could perhaps help them to come out of the situation. And this individual include the psychologists, we have the psychiatrists who could possibly help them to come out from the situation. And also it's good when we realize that someone who is around us is suffering from such a situation, we try to look on a way in which we help those individuals, loving them. And as individuals, another thing which triggers the mental problem is our self-esteem. When our self-esteem has gone down, then we will be in a trouble, and better chances for us acquiring that mental health problem rises. Yeah, thank you.
Hello. As my colleague have tackled about devolution, I'm going to tackle about the medications. For instance, the medication can be applied by government, that is national government and the county government, by keeping upper hand on preventive medicine than the curative. Also, another mitigation is also the Ministry of Health can be responsible about the health of the individuals. So it can be returned to the national government instead of devolving this health sector.
They say unity is strength, and we came together as stakeholders in this very crucial department to bring our agenda to this noble country that we so much value because of the health of Kenyans. Hello viewers, basically we have been talking about the primary health care, where we have the preventive measures taken by the government. Now, as you have heard from my panelists here, they have elaborated and told us how it used to be done initially when it was at the national government. However, since the devolution came, we have had so many challenges. To begin with, they say that, the county governments nowadays consider channeling a lot of money to curative. Why? Because they can't have a chance of actually selling some of the drugs to put money in their own pocket. Shame. Number two, have you ever had anywhere in this country where the county government has ever purchased nets to take to its people who are suffering from malaria? Not at all. Shame. Number three, have you ever had any county that has ever organized whatsoever for immunization scheme apart from the one that was organized by the country for the 12 counties that were affected by polio? Not at all. Shame. So what are we saying? You cannot start building a house from the top. That is the curative measure we are talking about. What do you have to do? Start from the ground by ensuring that you have a strong foundation. What is foundation, dear doctors? Public health. So we stand here today to say that the government should, for it to save its people, consider going back to where we all began. By doing what? Ensuring that the preventive measures are put in place so that our people don't die of diseases that would otherwise have been prevented. May we join hands in solidarity to ensure that our people don't succumb to death that is premature because of the negligence of the people who have been mandated to take care of this. So what do you say, masters? let this Ministry of Health be taken back to the national government. Thank you, our viewers.
In solidarity, public health.
In solidarity, we say public health. Prevention is better than cure.